I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's my pleasure to be again hosting this medical alumni faculty series where we honor our wonderful faculty at the medical school. And I'm really pleased today to talk to Dr. Christine Peterson and from the Department of OBGYN, and she's recently transitioned into some other things that she's doing. So Chris, welcome.
Thank you. It's a pleasure and an honor to be here.
Well, I'm just delighted. So, what I like to do is always start by saying I know you went to school in the Northeast. You gravitated down to the District of Columbia for a while. How did you wind up at Virginia?
Well, I was in D.C. for 6 years in private practice. And it was a wonderful private practice. It was probably the first all-women OBGYN practice in the country. As far as we know, there had been pairs of women working together, but we were the first big group. There were 5, 6 of us, depending on the year. And I loved it for the first 5 years. Vertical learning curve, very, very skilled and compassionate colleagues. But by the 6th year, I was beginning to get a little bit bored and a little bit restless. It wasn't really quite for me. Despite the fact that it was a very, very successful practice. It just, something was missing. And so I sat down and I said, what is it that I really want to do? And I realized that I especially loved doing patient education. Our practice was right in the middle of downtown DC. Our patients were lawyers and women who worked for the State Department and business women and very highly educated women in that office. And then we had another office in Gaithersburg with teachers and nurses and housewives and other doctors, and they were just amazing and wonderful people. But in the early 1980s, women, other than those in the health professions, didn't know much about their bodies, and so we did a lot of teaching in the practice, and I wanted to do more of that. So I looked for a job at a student health at a university, and I wanted to work at a university that had a medical school, because I had also learned a lot in private practice that they hadn't taught us in medical school about how to relate to patients, how to run a practice, those kind of things. So I set myself up to, look at the want ads and stuff, and found the right ad and found the University of Virginia, and there was absolutely no hesitation at all.
I'm so glad you found that right ad. I find this fascinating because I started in private practice also for a few years, then gravitated to academic practice. So I want to ask you, how did that private practice opportunity, that experience, translate and help you as an academic OBGYN in this environment?
Yeah, very, very much. It gave me the confidence that I didn't have coming right out of residency, right? So by the time you've seen a lot of patients and done the procedures and just kind of learned the way that things work, I just felt so much more confident in being able to teach, right, at that point. It was I couldn't have entered academics right from residency. It just wouldn't have been a good fit for me at all.
So fast forward from 1987, obviously you've been here for a number of years now. You got involved in administration, you were involved in student activities, and I noticed also, of course, that you've been recognized for teaching. And that's not innate. I mean, sometimes it is innate, but we learn. And tell me a little about what makes a good teacher, especially in a medical school environment. What are your thoughts?
Wow. It began when, as an undergraduate, I had some really magnificent teaching, right? And I understood that they were applying the flipped classroom to us even then, right? You came to the classroom to apply your knowledge, and tests were applications. They were learning experiences and applications of knowledge. And I recognized the difference between that and not so good teaching early on, right? I was curious about kind of how did that happen. As a resident, I was lucky enough to come in contact with a colleague with a degree, a doctoral degree in education, whose specialty was teaching professionals how to teach people in the health professions, right? And so my formal education began there. This guy, Neil Whitman, had written a book called There Is No Gene for Good Teaching, right? With a step-by-step introduction, right? So know your audience, right? Remember where they're starting from. Start where they are. Find out what their learning objectives are. Make sure they with your own, you know, a very systematic approach. And so I brought that fundamental understanding and then developed it, you know, with, as you probably know, the trial and error, right? You learn some things, you make some mistakes, you do better next time, you have some successes, you keep those things going.
Well, I congratulate you for all the wonderful things you've done. You've been recognized by the Raven Society and other organizations here, and certainly by the students. I want to ask you, because I think you were involved as the Dean of Penn College also. I wasn't here when these individual colleges and the medical school were formed. Tell me your thoughts on that, and how has it really brought something new and exciting to the University of Virginia School of Medicine?
So the whole notion of learning communities, the subdivision of a class into smaller groups, was very appealing from the first time that I heard about it, because it enabled closer relationships among students, right? They had a cohort that they spent more time with, among a small group of faculty coaches for the clinical skills course, and then with a dean who could get to know 40 students in much greater depth than a dean could get to know 150 or 60 students, right, a student affairs dean. And so when we were discussing the possibility that this was happening, I was in on those conversations, fortunately. And it was just kind of a natural thing for me to become interested in it. And I think it has borne out very well, particularly with the newer generation of students, right, who need the connection with each other. There's so much electronic communication that anything that we can do to facilitate students actually being together, interacting, learning together, I think helps them immensely. And to have a cohort of 40 students that starts out in the same clinical skills groups and then rotates through their clerkships together just creates wonderful relationships that seem to be very, very long-lasting as far as we can tell.
So these students have actually stayed together in some way even after graduation?
We think so, right? We don't have a lot of data about that, but just anecdotally in terms of the relationships and, you know, as students come back for reunions and, you know, who's still in touch with who, we think we're seeing that. I don't know if you know this, but there's a remarkable coincidence in my being selected to be the Student Affairs Dean for Penn College. Vivian Penn was one of my teachers when I was in medical school. She was also my Student Affairs Dean for the last year of medical school. So when the school announced the names of the colleges, I raised my hand and said, please, right, could I have that full circle experience and honor her by doing the best I could.
Well,
and
that's
so,
wonderful.
and she's very connected to our college. You know, Vivian and I are very close, right? We talk regularly, and she loves meeting the students. It was
Absolutely.
one of these things that you could not expect life to hand you.
Excellent. Let me just transition for a moment to your research interest, which I think has been in HPV and cervical cancer. You know, I was reading an article just recently about the women, young girls and women who have not been vaccinated against HPV. It's the same group that haven't been screened effectively.
Mm-hmm.
And I was wondering your thoughts. So are we doing the job we need to locally, globally, in HPV prophylaxis of cervical cancer?
That's a great question. It varies in the U.S. from state to state. Virginia requires HPV vaccine in middle school, though parents can opt out, right? So the vaccination rates in Virginia are pretty good. We know that our entering first-year students at UVA, about 78% of them have gotten at least one dose of the vaccine, which we think is remarkable coverage. It varies, though. Some states don't have that requirement, and certainly internationally, for all the usual reasons, resource, access, we don't see high vaccine rates, with the exception of New Zealand and Australia. They have tremendously high rates, again because of government mandates and very, very, very effective PR.
So let me ask you, what are you doing now as you transition from the Department of OBGYN and all of the things you've been doing for medical students? What are you doing?
Oh my goodness, well, I have a spreadsheet of activities, right? I suspect you well know that one has to defer pleasures, right? Be a physician, and you do so willingly and joyfully, and then that list all of a sudden is there, and there's things that you can do. And some of the things are at home, as silly as defrosting the freezer, right? Or, going through the old tax returns and taking the things to the shredder. I have probably an acre of fabric that needs to be made into quilts. Our community has endless needs, right, for service, so I'm beginning to explore those opportunities. I want to read and write more poetry. I want to spend more time with friends, more time outdoors, more time with my husband. There is no shortage of activities, and I think you probably know that very well yourself.
Do you feel that you want to continue that connection with medicine that you've had over the years?
I certainly want to continue learning. I want to continue interacting with colleagues in medicine. I don't want a formal role, right? I feel like it's time for the younger people to take over, both in terms of their knowledge, right? And also in terms of leadership. But I do want to stay connected to the human beings and the good work that they do in medicine, absolutely.
Well, I congratulate you on everything you've done over the years for the University of Virginia School of Medicine. It's been our pleasure today to be talking with Dr. Christine Peterson, noted OBGYN physician here at UVA, who is transitioning to a spreadsheet of all sorts of things. So Chris, thank you for being with us today.
Thank you.